The negative aspect of AI is that people put too much trust into it. They think, oh, it's 100% right. And don't get me wrong, the AI programs have already passed all the USMLE licensing examinations for medicine. It has like a 95% pass rate in dealing with how well it does on those type of tests. So don't get me wrong, it can take a test, which is great. But to give you a proper diagnosis, this is the thing I always said to my residents when I was a professor of anesthesia. I was there attending. Everybody wants to look at monitors. In anesthesia, as an example, we want to look at monitors, make sure everything's going all right. But nobody looks at the patient. You can look at a monitor and everything looks great, but the patient's blue. And you're like, well, their CO2 is still there, or their SATs. So what? Sometimes that stuff is delayed and it still looks normal, but the patient is coding. You always have to look at your patient and you have to touch your patient to make sure that what you're getting or what you're thinking the patient has is what they have, And so that's what I have trouble with AI, because AI will tell you everything, by the good and the bad. As doctors, we need to use it as just a component on how we learn things, or how we're trying to diagnose a particular issue that a patient may have that can help us quickly, okay? Whereas when you have patients that just want to talk about that, I like questions. I like them to give me questions, but sometimes they focus on the things that have they happened? Yeah, but it would be very, very difficult for that thing to happen to them. They only focus on the negative and they don't focus on the positive for certain situations. Now, granted, that's in my pain management side of when I treat patients inside, and even in regenerative medicine, because they've been dealing with pain for so long, and so they're going to be thinking a little bit more negative. But AI it's going to help a lot, but there's also, it's not black and white. It has its negative aspects. So it's all about data. Everybody always said, oh, the golden rule, he who has the gold makes all the rules. Well, now it's not the golden rule in the sense that he who has the gold, it's he who has the data. You control the data, you're going to control everything to make the rules. And so that's what's a little worrisome with AI, because they're already having breaches. There's United Healthcare had one. What was it? Epic had one. There's some of these smaller software companies that utilize for EMR. I'm talking about EMR, electronic medical records. They utilize AI, which as well they should. But they've had breaches, and it's just for whatever the reason. Or AI sees a glitch and it's thinking it's doing the right thing, but it sends it off to the wrong email, or sends it off to somebody, to another server that it shouldn't have sent it to, because this has to be a HIPAA compliant server, right? Yeah. And people always think when you have to be very careful. When I use ChatGPT or Gronk, there's an aspect of it that is HIPAA compliant. And so, and I'm only using it for what, for this HPMI, that's the health information for the patient. And, but ChatGPT is not HIPAA compliant. Gronk's not HIPAA compliant. There are aspects of it that can make it HIPAA compliant. So you have to be very, very careful with that, because once you put that out there of a very specific, the patient's information, if you don't do it in a software that is HIPAA compliant, now you've sent that patient's information out to Lord knows where. Yeah. Because everybody talks about, what is the cloud? Yeah, you send it to the cloud, and who knows what can get to it and get that information.
Then it'll start raining.
Who knows, man? And you have to be
data.
You have to be very careful with that, And so that's why a lot of people, it's great. Don't get me wrong, it is awesome, but it also, the other negative aspect, and this is the older person in me talking. People are reading less. They're only getting this is now our generation's Cliff Notes. I had Cliff Notes, but I had to read my Cliff Notes, right? There was an actual book that had Cliff Notes, and that's where we get that term. Their Cliff Notes is you just talking to your phone, and it summarizes everything for you. And so you have to really be careful with that. It is getting better, and I think literally by the week, these software engineers that are helping develop all these things, it's getting better and better.
And accuracy of information is really important on their
I don't want them giving me Wikipedia stuff that anybody can change. I want them to give me something from the Journal of Medicine, that I know, that's a good.
Well, you can also prompt it to say, like, is this from a medical journal or is this from a...
And you can, but see, a lot, you and I may know that, but the standard person is not going to do that. They're going to just ask it a question and then maybe get a little bit more specific with that question, but not that specific.
So I think it really is like, for when I use AI, I've started to put my own mental barriers and guardrails, and I just use it in a way where I ask it as if it was... People see, the thing is, people use it as like an all-knowing, all-seeing eye.
That's, you cannot use that. It's a great tool. But you have to put safeguards on. I
see it as, the safeguards I use it as is as if I was talking to somebody who, in like the most respectful manner. But if somebody who is like autistic, right?
Yeah.
Like they have all this knowledge. They might be super smart, and they might be like, I know this and this and this and this, and they're excited. But then you bring up like the social aspect of something. You bring up the issues that could be tied to something, and it doesn't know the context properly. It's gonna be like, well, no, but that's accurate because of this. And you have to say, well, there's also these emotional and non and this and compliance.
There's nuances according to where you are culturally.
Right.
You know, and this is the thing. There has been some issues with certain AI software in healthcare that has shown bias to a particular ethnic group, bias to income, bias to what part of the location is, if it's in a, East Texas or in Kentucky versus a big metropolitan area like New York or,
here's the
LA.
thing.
So you have to be careful with that.
Yeah.
And it's showing, and the reason I bring that up is because bias is not, it's telling you people, whether they're black, brown, or white, have the exact same symptoms, as an example. And the AI is telling you different treatments for each of these people. And it shouldn't. It should just be for a human, right? But it's telling you.
Do you think it's one of those, isn't that situation where Elon Musk had the Tesla, and the Tesla self-driving has to choose between a baby in a carriage with a mom and a little boy with a ball down the street, and the car can swerve left or right to avoid whatever, but it has to choose one. And it's like, choose who's going to die, Like, and they've put it in situations.
Well, what is it? iRobot with Will Smith. It was the exact same thing. And that's why at first he didn't like any of those robots, because he wanted the robot to save the little girl.
Yeah.
But the robot looked at both situations, its AI computer, and found that there was an 83% chance that he was going to survive versus 31% chance for that little girl. And so the robot saved him. The sad thing is that they want, as an example, AI wants us to flourish, but sometimes it will.
You have a higher chance, but then that girl had the rest of her life. Wasn't she a little girl, right?
Yeah,
so she had the rest of her life.
And that's just an example, and that's in the movies, and
But that is how it works.
But you have to kind of think about that. That's the ethics behind.
And that's medical. AI. That's it's if you're in a medical situation, and if it was like some sort of futuristic emergency. I don't know how it could. Well, you never know. But
it's always going to triage. There's been issues with this AI software in different triage. And triage is just that. You triage who's going to make it, triage who has less a percentage, and you have to treat the people that you can save. And sometimes the other ones you just can't save. And that's the whole aspect of triaging.